The flu is a respiratory disease like coronavirus. Is that correct?
That is correct.
Well, how do you know if you have the flu as opposed to coronavirus?
Well, the definitive test would be to get a test for the flu or a test for the coronavirus. There is overlap in symptoms. The situation with coronavirus is predominantly fever and a lower respiratory infection, as opposed to an upper respiratory infection starting off with, and then you might get a pulmonary involvement, which is flu.
What's a lower respiratory?
Your lung, as opposed to sore throat, sinusitis, sneezing. When you have lung involvement, you can get that with flu, but usually it's upper respiratory and then lower.
So fever and a cough is...
Fever and a cough can be for either of them.
Okay, what should you do if you have fever and a cough?
Well, it depends on the circumstance. I mean, if you're in the middle of a flu season right now and you have fever and a cough, obviously, if you have a cough, it could be a pneumonia. You should see a physician. Certainly, if you're a person in a risk group, elderly or underlying condition, during the flu season, you should see a physician because we do have antivirals for flu, and you could be helped by doing that.
Should we all be wearing masks?
No.
Why?
Because right now, there isn't anything going around in the community, certainly not coronavirus, that is calling for the broad use of masks in the community.
Why do healthcare workers wear masks in the hospital then?
Well, because a healthcare worker who is taking care of someone who is known infected with a transmissible virus, that's different from walking around in the streets wearing a mask.
Are children getting the coronavirus?
To a much lesser extent than adults. And for reasons that are still unclear, it may be that they are getting infected, but their symptoms are so low they're not being recognized. But in a number of reports that have come out from China, there are very few cases less than 15 years old. You'll always find the exception, but most of the cases are a mean age of about 50.
What can we do, or what can our families do to protect ourselves? What's the most effective thing?
Right now, and I think the question you asked about flu is important. Right now, we are still in the flu season. What you can do to protect yourself against the possibility of coronavirus is the kinds of things you would do to protect yourself against flu.